Hello everyone, welcome to Functional Nurse Academy Graduate Feature. For more information about Functional Nurse Academy, be sure to go to functionalnurseacademy.com. And here's your host, Nurse Melissa.
Welcome to the Functional Nurse Academy Graduate Feature. During this show, I love to spotlight the incredible journey of nurses who have transformed the way that they practice and also their mindset through the lens of functional medicine. My name is Melissa Schreidfatter, and I am the founder of the Functional Nurse Academy and Christian Functional Medicine Academy. In today's episode, I'm going to be sitting down with one of our amazing graduates and hear how she is using functional medicine and using her own independent business to change lives and redefine what it means to be a nurse in today's world.
We're going to talk about everything from peptides to methylene blue to the use of exosomes, because again, there are things that are out there, but we just need to provide that information and then let people know how they can access these things. So I am so happy to have Liz Sandt with me. Now, Liz is a super experienced nurse. She does not look like it, but she's been a nurse for 23 years and she's been in the functional medicine space for about 8 years. And she is the founder of Elevate Wellness. Welcome, Liz.
Hi, thanks for having me. This is very exciting.
Yes, anytime. So Liz and I met at a conference back in 2022, and it was one of those nurse freedom type conferences, because we all know that everything just went to hell over during COVID, and especially in the nursing profession. So it was so great to connect with other like-minded nurses, and especially other functional medicine nurses, because there's so much that nurses can do in this space. So I know that we recently were chatting about doing a show together, and in your practice, you've been doing a lot of work with peptides, and I would love for you to give our audience a little bit of an overview, like what are peptides and what kind of health benefits can they offer?
Yeah, peptides are really hot right now, and I have a feeling within the next year, I think it's going to be more mainstream and more people are going to know about them. So I feel really honored to be bringing this little intro to your audience here. So peptides are essentially small proteins. They're amino acids, like short chains of amino acids, and they are naturally occurring or they are synthetic. They're antimicrobial. Some act as hormones like insulin, neurotransmitters, or peptides that signal the body to build more collagen are used in skincare. So there's so many of them out there. I feel like when people hear peptides, they just think of GLP-1s. And that's actually what kind of piqued my interest into peptides, because I really didn't understand a lot about them or how many there are available for use. There's a lot that are used in the longevity space, in functional and longevity medicine. And I really hope that more conventional doctors get on board with a lot of the different peptides, especially like the thymosin that we were talking about, and BPA.
Yes. So I also have been interested in peptides for a while, because when I was just suffering like crazy with Lyme disease, and again, praise the Lord that I have been healed from this and I actually feel like a normal human again. But anyway, when I was really sick with Lyme, I had issues with chronic fatigue. I was also hypersensitive. I had hypersensitivity to all these foods and chemicals. And I also had mold illness. I mean, the list just like goes on, right? And that was so I was trying to just throw the kitchen sink at it, and I wasn't having good success. And one of the tools that helped me kind of early in on the journey was peptides, specifically Thymosin Alpha-1 and BPC-157. I actually noticed when I was really, really sick that like I started to have improvements in my energy. And some of these peptides have the capacity to modulate the immune system. And if someone is sick as a dog with chronic Lyme disease, you have mold illness, we know that there is a factor of immune dysregulation, which I think a lot of people are walking around with immune dysregulation today because of all these things we've been exposed to. And then you get immune dysregulation, and then you end up with reactivated infections and stealth infections and all of these things. So with these peptides, so I wanted to ask you specifically about like the capability for them to modulate the immune system. So in the clients that you have worked with, have you worked with anyone that was having, you also mentioned they're antimicrobial. Have you worked with anyone that was using them that was having success for people that have things like chronic infections or other immune health disorders?
Yeah, here in Florida, especially, there's so much mold infection. And I think that people there again just aren't even aware of it. Conventional doctors, I actually asked my son's pediatrician if they offered a mold test, and she said there isn't one. And I said, well, I know there's one because I order them for my clients, but I was just wondering if you would order one. And she said, oh, well, there's some out there, but we don't do that. So at first she said there isn't one, and then it went from that to, oh, it's there, it exists. But there are so many people who have been helped with the thymosin alpha, and you and I know that Epstein-Barr is at the source of a lot of chronic illness, and Epstein-Barr, Lyme, and mold, I think, are the top three, along with, even just taking it as a preventative. I plan definitely on getting some to have as a preventative for this upcoming season, so I don't get sick.
Yes. So I know thymosin alpha-1 is huge for the immune system. And again, when your immune system is dysregulated, it is not because you have a deficiency in thymosin alpha-1. But again, these are tools that people should know are available for them to use. Because again, when we just to give you an example, when I did, I wrote like a deep dive mentorship on Lyme disease, and the CDC finally started recognizing chronic Lyme, but they were calling it post-Lyme disease treatment syndrome. And they were basically recognizing, okay, people that maybe had acute Lyme and were treated, okay, maybe they might still be sick. But, oh, we don't recommend treating the infection. No, we just recommend treating your symptoms, giving you some, pain medications and some antidepressants and things like that. So that is what people are being told when they go to these run-of-the-mill providers, that like, oh, this is all that we have for you. And this is one of the reasons why I love nursing and I love functional nursing, because we can stay more up to date with what is out there. Because as functional nurses, we know good and well that there's kind of a, 17-year lag in translational research. And we discover something in the literature that can be helpful. On average, it takes about 17 years for that to get implemented. It takes that long for that information to get in the hands of your medical professional. And then it may not even ever get into their hands if this, modality is a competitor for, big industry. So I think that's interesting. You mentioned that your son's pediatrician was like, oh, there's no mold test out there. So, yeah,
like,
now
I know there's one.
yeah. And so another one, BPC-157. So that one is like really hot right now. Can you tell us a little bit about that peptide?
Yeah, so there's an injectable form and there's oral form. It is effective for joint healing, soft tissue healing. It's also effective for gut healing. It heals the gut lining. So I actually have a client who started taking it for a joint issue as well as a gut issue, and she feels so much better. She's way less bloated. She can tolerate eating more foods. She's able to exercise now because her injuries are healing, and she's just so grateful. And it's really a remarkable peptide.
And again, guys, I do not just know this. I looked this up. So BPC-157 is technically a synthetically derived peptide, but it is derived from partial sequence of a protein found in human gastric juice. But you may have heard about this. A lot of biohackers are using things like BPC-157 as well as a lot of we're starting to see this more in the field of regenerative medicine. But we know when we're working with people on the foundations of wellness, right? We want to help to get people active. There are so many health benefits to getting out there and becoming active. But I mean, the client that you just referenced that like wasn't exercising because of her joint pain. That's awful. So there's ways that we can help to mediate that. And also the client that you just mentioned that she had improvement on BPC 157. Did she need to stay on it to continue to have improvement with her symptoms? Or is this something she was able to use for like a specific time frame and then stop?
I think everyone's different. She actually just texted me as we were starting, and I think she wants to have a discussion about like what's next because she's just finishing her third month. And she elected to take the oral form versus the injectable form. So everyone's different, and it depends on their situation on which one is better. But I think typically if there's a soft tissue situation or joint situation, the injectable form is, from what I understand, better to inject directly at the site of injury. And then the oral form is better for a gut health issue. We all know how many people are suffering from gut health issues, right?
Yes. And this is a clinical pearl for everyone. If there's just a multifactorial things going on in the body, say you were a practitioner and you're working with this complicated case and you're like, I don't know where to start in the gut. If your gut is a mess, that is really going to inhibit your body's ability to properly absorb and utilize all of those amazing nutrients that we get from food. So, but yeah, I was well aware even before I got into functional medicine, I had heard about functional and holistic providers using this to aid in the healing of leaky gut, aka intestinal permeability, because we know that this is an issue for so many people. And now also, okay, so we mentioned Thymosin Alpha-1, BPC-157. Now tell me, because you're a registered nurse, correct? With board certifications in functional medicine, super experienced. Now, with your practice, there's so much confusion. A lot of nurses are like, well, I don't think I'm allowed to start a practice because I'm not a nurse practitioner, and I'm always trying to educate. There are so many things that we can do under the scope of practice as a registered nurse, especially when we are partnering with other, especially when we have partners where we have access to MDs. I mean, for an example, with my practice and how I teach nurses that I train, I'm like, you can order labs. But again, you're not just doing that on your own. You're partnering with a laboratory and you're ordering under an MD. Is this also similar how when you work with a client and you support them through peptides, are you also partnering with another company that gives you access to a medical doctor to where you're able to offer this as a service?
Yes, and actually, I had such a great experience, and I know we're going to talk about this later with using tirzepatide, a GLP-1 GIP, that I thought to myself, I need to refer so many people for this if it's right for them, of course. And also when I started learning about all of these other peptides, I'm like, oh my gosh, there's so many people who can benefit from these. I actually went on a search to find an MD or someone to partner with and to see if there was some sort of like affiliate partnership out there. Because I was like, I'm just going to be referring people left and right here. And I needed to find someone I could trust, someone who was knowledgeable. And of course, it's nice to have an affiliate type of compensation for a referral fee. So I found a company, it's Telewellness MD, and I was able to join their affiliate program. Now, they don't allow just anyone to join their affiliate program. They want to have knowledgeable affiliates, preferably in the medical or the wellness space. But it's founded by an MD. He is a functional and longevity doctor. He has a brick and mortar in Clearwater, Florida. He also has a program for practitioners to learn, for nurse practitioners, PAs, and MDs to learn about peptides so they can prescribe them. But for people like myself who have never really had a desire to prescribe anything, and my goal is always to get people off of things they don't need, so they don't need prescriptions. The affiliate program was just exactly what I was looking for. And they provide education. We have weekly phone calls, and Dr. Agan's on the calls like 90% of the time, I would say. And we can ask questions as affiliates. We receive all kinds of educational information. And it's really fascinating. And he genuinely wants people to be well. And that's refreshing. It's not about like the money for him at all. Like, he actually will help people with addiction. And then if they follow the protocol that he recommends, he'll give them their money back. I heard him say that recently.
Oh, that's wonderful. So I used to be an addiction nurse. And I have a really big heart for these people because there's a lot of suffering. And so are you saying that with the peptides that they can help people suffering with addiction?
Yeah, the GLP-1s.
Oh, interesting. Yeah.
For addiction right now, and addiction.
Okay.
Also, in Alzheimer's, they reduce inflammation and they increase neuroplasticity. So I think we don't even know all of the things yet that they're going to be good.
Yeah.
Healing. So,
and I do think it's good to touch on the GLP-1 agonists because now these are, if you've seen the commercials for Ozempic, Wegovy, things like that, those are types of GLP-1 agonists. And again, there is an uproar right now in like the holistic and functional medicine communities about the GLP-1 agonists because there is so much inappropriate use of it, guys. There's a variety of uses for them if they're used appropriately. However, we see them just being doled out left and right like candy to people who want to lose, 10, 15 extra pounds. And a lot of times they're used inappropriately, especially in these weight loss resistant cases when we haven't even properly evaluated what's going on with that person's hormones. So they can be there. Like now the GLP-1s, they can be very high risk. There are a lot of side effects associated with them. However, I know that we have had a variety of differing perspectives on this on the show. We've had providers that don't like to use them. We have providers that advocate for them that have come on and they're like, hey, it can be a miracle drug if they're dosed appropriately and if they're used appropriately. So that is something new to me. I did not know that they could help with addiction. So, and I wanted to ask, because I know you had a good experience with this. So something else that I hear being said in the wellness community when it comes to weight loss is they're like, well, once people start on these medications, they're on it for lifetime. Is that true, Liz?
I don't think so. Although with my experience and the way I feel, I don't know that I want to go off of it because so I'll just backtrack and tell the whole the whole story now. So I started a little over a year ago working per diem at a local functional medicine office. It's owned by a PA and she is so brilliant. She is like smarter than most doctors I have ever met. And she dedicates her entire, like it's her passion. She's always at a different conference in every weekend, like Miami and Vegas. Like she just got back from a peptide conference. I really, really respect her. And when I first started working there, she knew I had my practice and that I had completed your program. And I'm like, I just can't lose weight. I just keep gaining weight. I felt like I had almost like, you know, how am I going to help my clients because I can't even help myself? And like imposter syndrome, you know, and I'm like, what is going on with me? I have been eating clean for years. I have tried intermittent fasting. I have tried keto. I've been at the gym doing various workouts for years and years, like Burn Boot Camp for a year, another gym before that for 2 years. I joined Lifetime Fitness, which is like the most bougie gym in the whole area. And you can do unlimited classes. And I'm in there 5 days a week and just gaining and gaining. And so my mother, my brother, and my grandmother and her 6 brothers and sisters were all diabetic. So I have a genetic tendency to have insulin resistance. And that's what was going on with me. And she said, well, why don't you just try tirzepatide? And I was like, what? Like, I can't even believe she suggested this. Like, you know, I don't want to do any pharma. Like, I'm so like anti-big pharma. And then I started seeing her clients, her patients coming in who didn't even need to lose weight for their tirzepatide injections every week. And I'm giving these injections to these people like, what is going on? Why am I doing this? And I started talking to them and they were taking it for anti-inflammatory. So they didn't have joint pain or some, you know, for various reasons, but microdosed. And then I heard a podcast, Dr. Tina Moore, that someone recommended in a Facebook group about GLP-1s. And I thought, she's a chiropractor and a naturopathic physician, and she's like in support of this. Like I have to listen to this. So she sold me. Like everything she said resonated with me. And I decided to try it. And with tirzepatide, I lost 40 pounds. And the only side effect I had was reflux. And I, at the suggestion of the PA, Elizabeth, I took a GI supporting beverage from Nutritional Frontiers with like aloe and marshmallow. And I think it's like GI Protect or something. And then I was fine after the first few injections, but my joint pain disappeared. I had stiff and a lot of inflammation in my hips in the mornings when I would first wake up, and that disappeared. My brain fog disappeared. I did lift weights. I was listening to Tina Moore's podcast, and she's a big advocate of heavy weightlifting for women, especially as we get older. And so I started weightlifting. I stopped the HIIT and the hardcore cardio, and just started walking on the beach. And slow and steady, is how I lost. And I'm grateful for that, because I, didn't want the GI upset and the saggy skin and all of the things that come with the quick weight loss. But what's happening with people who are having the side effects is that they aren't changing their diet, like we talked about briefly. Like I saw a TikTok once, and it was like, what I eat in a day on semaglutide or on Ozempic, and it was like 3 Doritos and a half of a McDonald's cheeseburger. Like, what? I mean, I just continued with my healthy diet and really focused on protein, like trying to get to 100 grams of protein a day. That's so hard for me. I think I average about 80. But the people aren't changing their diets, and they're losing too fast, because with the pharmaceutical, the Ozempic and Mounjaro, they come in these pre-filled plastic pins, and one pin is the dose. And what functional medicine providers and longevity medicine providers are doing is starting at maybe a quarter of that dose and gradually working their way up slowly, so that people aren't hit with all of these side effects. Also, there's a lot of people who aren't changing their diet and not moving and not taking in enough fluid, and they're constipated, and then they wait. I think I read one woman who sued one of the companies, waited 10 days before she went to the ER. She hadn't had a bowel movement in 10 days. So that, I feel like the providers who are prescribing these things just they're not following through with their patients, and they're not giving them I feel like it's a tool. The GLP-1s and GIPs are a tool to help with other lifestyle changes, but they're just not making sure that people are doing these things. And it's really sad, because I feel like I've talked to so many people who have benefited from them, and I am just a big advocate. I feel great. I really do. And especially with the Alzheimer's studies, there's so many studies where it's helping stop or reverse Alzheimer's, and it reduces cravings, which never was my problem. I never had a big appetite. I never had sugar cravings. It was just my insulin resistance was in full effect, like not allowing my metabolism to function. And so yeah, I'm a big fan.
Well, I'm so glad that you had benefit and you're feeling better, because again, it's another tool, but with any type of medicine, any type of therapy, they must be used appropriately, and people need to be given that proper informed consent. So, well, we are about ready to cut to a break. If you are a nurse that is fed up with the sick care model, I have a solution for you. My name is Melissa Schreidfatter, and I am the owner and founder of the Functional Nurse Academy. FNA is the most comprehensive functional medicine training program on the market, specifically tailored to nurses. It is self-paced and equips LPNs, RNs, and nurse practitioners to practice functional medicine, address the root causes of dysfunction, and start their independent functional medicine practices. At FNA, you will learn how to order labs, functional health reports, create customized wellness plans, package and price your services, and even how to market your brand effectively. Graduates earn 90 nursing CEUs, and then they qualify for multiple board certification titles. They also will have access to our exclusive tools, such as our Functional Nurse Toolkit, our social media and marketing kit. And I don't want to just train you and send you on your way. So you also will get access to me each month via the Functional Nurse Academy monthly mentorship program, where you will be able to attend a live class with me each month. So say goodbye to sick care and start your dream career as a functional medicine nurse. Enroll today at functionalnurseacademy.com. Hello and welcome back. This is your show host, Melissa Schreidfatter. And today I am joined by one of my Functional Nurse Academy graduates, Liz Sandt, owner of Elevate Wellness. And Liz has been real busy helping people with lifestyle and nutrition, helping people to heal from the inside out. And she also has been using tools in her practice, such as peptides and things like methylene blue. So we're going to be talking about those things today because, again, there are so many tools in the toolbox of medicine, and a lot of these things people don't even know about them. So I really want to get the information out. Welcome back, Liz.
Thank you. So fun to be here.
Yes, it's always so fun to talk about these things because, again, like I feel like I learn something new every day about another tool that can be helpful because there are so many suffering people. And it's just like, if there's something that we can use to help them, it's good. It's good for them to know about it. So the first half of the show, we talked about some of the benefits of some of the most common peptides, BPC-157, Thymosin Alpha-1. We also know almost everyone has heard about the controversy of GLP-1 agonists. And we just talked about how Liz had a really good experience and how they are being used improperly, they are being dosed improperly, and how there may be really significant side effects when they are microdosed and when they are used responsibly. So I did want to touch on real quick now, I know that you mentioned as an RN having your own functional medicine practice. If you're working with a client and they want to try using peptides, are you able to assist them in that? Like, how would that work?
Yes, so I'm partnered as an affiliate with TeleWellness MD. And if any listeners are interested in partnering with them, I can connect anyone with the business management department for the affiliate program. But I refer my clients through my website, my link that's directs to me. And they would create an account, schedule an appointment. There's a complimentary 15-minute consultation, actually unlimited consultations, and the doctor or the nurse practitioner would talk to them and, if appropriate, write the prescription to a compounding pharmacy, depending on what state they're in and what peptide it is, because it is complicated out there in peptide land. Some states don't allow certain peptides to be shipped, and they don't allow certain dosages of certain peptides to be shipped there. So it's kind of complicated. There's a long list of what can go where and how much of what. And so they would determine that, and then the prescription would just arrive at their door. If it's an injectable, they would be drawing up the amount of peptide that the prescription calls for and injecting themselves. And we have educational information on how they can do that. So it's typically, just a very small amount with an insulin needle, a few units of whatever peptide, if it's an injectable. But I love having this partnership because the doctor who owns it is extremely knowledgeable and very passionate. A lot of people ask me about hormones, about bioidentical hormone replacement therapy. And a lot of people want that. And I have really not been able as an RN to help them with that. So they're going to be starting to do BHRT very soon. So I'm really excited that for people who want that, they'll be able to have access to that, testosterone, estrogen, and progesterone.
And that really piqued my interest when you were talking about how difficult it is to get certain peptides, because when I think about other pharmaceuticals that are out on the market, things that you can go and get over the counter. I mean, you can go and get Tylenol over the counter. Tylenol, there are so many deaths from Tylenol per year. There are so many overdoses. If you overdose on Tylenol, you can end up with liver failure. And I am like, why is this available over the counter? But then it's interesting that certain peptides specifically the ones with really very mild side effects. When I was dealing with my Lyme situation, pretty much one of the most famous peptides for Lyme and immune modulation is Thymosin Alpha-1, but the FDA restricted it, making it more difficult to get. But then, the side effects of Thymosin Alpha-1 are usually like redness at the injection site. Are you aware of any other serious side effects? I mean,
The only ones that I am aware of that have side effects are the GLP-1, GIPs. If the dosage is a bit too high, typically that's what happens. As far as the other ones, it's like redness at the injection site or itching. So
yeah.
it just blows my mind that they're
Uh,
being restricted.
yeah. I thought that was so that I thought that was so interesting. But we have seen that the FDA has a little pattern of doing things like this. So I always get like a little suspect if I feel like the FDA is trying to get their claws into something, because then I start thinking, I'm like, okay, maybe this actually works to fix something. So I am hoping that we will see less of that with our new, administration. But yeah, no, I think that is interesting that there are so many hurdles. And something else that we had talked about that I am also very interested in and learned a little bit about when I was sick with Lyme was methylene blue. So can you describe to our listeners like what that is and what it is being used for?
Well, it helps with mitochondrial function and cellular energy. So there's a lot of functional medicine offices that are actually starting to do methylene blue IVs. I've had one. And then I went into the red light. So the red light really helps to activate your cells after methylene blue. So if anyone has a red light at home, even if you're doing like the oral drops or tablets, a red light is really great for that. But it helps with cognitive function and energy. I actually took it before I went on a trip to Peru. I went for my birthday back in February, and I was hoping that it would help me with any potential altitude sickness and help my energy while I was traveling. I did have a bit of altitude. I had elevated heart rate when I would lay down at night, and I had a headache, which I never have, just for the first couple of days. But it gave me so much energy. Typically after I do IVs, like if I'm doing blood ozone or something that's going to be detoxifying, I get really tired. But I came home after a full day of working at the functional medicine office and staying after to do my IV and doing the red light, and I came home and cleaned my entire house. So that and another favorite of mine is NAD plus. I took some before our show here. It's great. It reduces brain fog. It helps me personally feel very sharp and very productive. So I do an injection of NAD about once a week, and it helps metabolism also.
Yes, interesting. And methylene blue, I'm hearing a lot more talk about it. Now, methylene blue is a synthetic dye, but it has been found to widely have really amazing benefits when it comes to supporting mitochondrial function. And again, when our bodies are sick, and again, people usually get sick because of things like crap food, stress, and toxins. But again, your body is designed by God to heal, but you need energy to heal. So even though it's not something that's technically like naturally derived, it could be another tool that can really help with your mitochondrial health. And one of the reasons how it does that is it helps to reduce things like oxidative stress. It also supports like the ATP production. There's a lot of really interesting uses for it. And what do you think about the side effect profile for methylene blue?
I didn't have any side effects personally. If people are taking an SSRI, they should not take it. I've heard of people having headaches with it. But other than that, I haven't personally witnessed any side effects.
Okay. Yeah. And again, when you're considering adding another tool into your regimen, it's always going to be that risk versus benefit. So one thing that I'm always looking at is I'm like, okay, how long has this thing been out for? What are the known side effects? What are the known benefits? And then make your decision that way. So also, I'm hearing of functional providers that are using things like methylene blue for infections like Lyme disease. Have you heard about IV methylene blue?
I did an IV of methylene blue.
How'd that go?
Was great. I had a ton of energy. I was thinking the other day about the dye that's used during surgery. And specifically, I remember working in the hospital in the med surg unit and having women who had bladder surgery or GYN surgery coming back to the floor with blue urine. And I was thinking, and I haven't even researched this yet, about perhaps women who have chronic UTIs that would be good for. And like I said, this is just like right off the top of my head, but definitely it's great for energy. I had a ton of energy.
Yes. And I remember when I was so sick. Oh my goodness. Like the fatigue was awful. And I had like a young child. I had zero energy. And again, it's always like there's certain tools we can use, but it's always good to really work to help to identify why are you having these issues in the first place? Because again, there are tools that we can use, but you want to really investigate those root causes, because you don't want to end up using a whole lot of tools, getting well, and then having a relapse because the root causes were not addressed. Now, NAD, you mentioned as well. So I am seeing that there are, in the area that I live in, there are so many new IV hydration clinics popping up left and right. We have mobile IV clinics. This is something else that I'm seeing. Nurses also at the registered nurse level starting their own IV hydration clinics through the partnership of an MD. But I'm seeing a lot of IV NAD, which now NAD, can you describe a little bit like what exactly is that? Is that something that is naturally occurring?
Well, it helps with energy. It is naturally occurring. It decreases as we age. And it helps with DNA repair, cellular energy, metabolism, and glycolysis. So I have never done personally an IV of NAD, but it's a process. Like when I administer that at the functional medicine office where I work per diem, we're placing people on oxygen, we're giving them caffeine. If it goes too quickly, they can have chest pain. I'm not interested in that personally for me.
Yeah.
I do the sub-Q shots myself. And, you can walk into one of these IV clinics and do a sub-Q shot, but you can also order it and have it at home and give it yourself. So I just do it once a week.
Yeah. And what's interesting about NAD is it's actually found in like every living cell, and so it also, like, how we talked about methylene blue helps us support the mitochondria. NAD also has a role in things like DNA repair and cellular energy production. And again, when your mitochondria is shot because your body has been so overburdened with things like toxins and infections, again, these can be things that can really give people relief. Now, I did want to also ask you about, so you had mentioned before we started the show, exosomes. So I'm seeing a lot of talk about exosomes as well in the field of regenerative medicine. I'm really interested in regenerative medicine, by the way, because it's like we're using, more up-to-date medical technology, and there's just there's so much potential of so many things that we can help people with. So what are exosomes and what do they do?
Well, they're little signals to cells to do what they're made to do. And what I do with them is I microneedle them. As an RN, I took a course for microneedling, and that's something that we can do. We don't have, in the state of Florida anyway, I don't have to have an esthetician license to do that. It's considered medical. And so I use the exosomes and I microneedle for facials. It creates collagen, or helps your body to create collagen, which reduces fine lines and wrinkles. And then also I do it more for hair restoration for people who have had hair loss. Really, no matter the reason, I have probably more women that I've worked on than men. And I feel like a lot of women have lost their hair from too much testosterone when they start taking testosterone. Specifically, I've noticed like people who are taking the pellets, which I don't really personally align with, like because you have like a certain amount of estrogen, testosterone, and progesterone or whatever's in the pellet that's inserted into the body surgically, and then you can't remove it if it's too much, or if you have side effects, it just has to dissolve and go away over a period of months. But a lot of women who have had hair loss from that, also COVID, and men who have had hair loss, I am so happy when people come back for their second and third treatment, because I can tell that it's working, because I can see the little hair follicles on their head and they're like, oh, I don't know. I don't think it's, and actually I have, you can see here, we're video recording here for those of you who are listening audio, but I have all of this new little hair that looks like broken hair, but it's not. I had some hormonal hair loss as well. And I've loved the results, but I'm super happy for especially the men who have, are really self-conscious about it. And I'm actually getting ready to do a treatment on one of my best friends who has had hair loss for unknown reasons for a few years now. And she's so self-conscious about it. So I can't wait to do it for her and see her results.
And guys, our hair is a big deal, and for men, yes, of course, but especially as women. And, I had some hair loss from Hashimoto's, and I got that under control, and my hair came back, and it was fantastic. And then, do you know what happened? I got COVID, and then my hair started to fall out again, and I finally have the good hair back, But I'm like, it was so frustrating. You do all of the hard work for the hair regrowth, and then something happens, like a god awful virus or whatever. But that's interesting. I also like that. I'm so interested about the, upcoming movement of nurse entrepreneurs, because, oh my goodness, we are probably one of the most fed up professions. The system has been abusing us for years, and it is really nice that we can use that RN licensure to implement all of these different services that we can add into our practices. So I think that's fantastic. And I did want to touch real quick on because we're featuring you for the Functional Nurse Academy, and I wanted to ask about your experience going through the program.
Oh, I loved it. It was exactly what I was looking for. And I'm so glad we met. Something just told me, go to Orlando. It was like a last minute decision. It had kind of been on my radar. But there was a couple of people who I really wanted to meet and hear speak at that conference. And I'm like, I'm just going to go. So I drove up, and then I saw that you had your program available, and it was exactly what I was looking for, because I had some functional medicine background at the time, and I had been diving into functional medicine on my own before I even transitioned from the ER into functional medicine. But you provide so much knowledge in the program, as well as the mentorship, the monthly mentorship. And what I really, really, really loved and what really drew me in was the toolkit, because it's like a plug and play business. And that technology aspect of having my own business and creating forms, oh my gosh, that was so intimidating to me. And you have everything right there laid out, just to be able to jump in and start before you even finish the program. Really, you can start working on setting up accounts and getting your website up and running and thinking of what you want to do and what you want your niche to be. And it's so fantastic that and I love that you have the goal to help other nurses, because you are so fed up with the system, and so many are, and they feel trapped, and they don't even know that we can do this.
Yes, and it really was. I'm so glad thank you for all of your kind words. And I'm so glad you had a good experience. But no, it really was from my frustration of what the system has been doing to nurses. It was kind of like the anger I felt from that. I just kind of poured that in to developing Functional Nurse Academy. And I remember when I first started out as a functional nurse, I also had a 2-year-old. And, and again, like we're all crazy busy, but I was like, I had to go and create all of these things from scratch. And so I'm always envisioning like, okay, the person I'm helping is a crazy busy nurse that desperately wants to get out of the system. So I'm always thinking about like, how can I make this just easier for you guys to have like done for you options and the proper guidance. So, okay, but yeah, I really do think, what has happened in our country with healthcare, there is a big mess. And I think that the nurses are going to have this like massive role in cleaning it up. So I also want to hear about your practice. So I love the name Elevate Wellness. And tell me, so I know that you are located in Florida, but what kind of services are you offering through Elevate Wellness? And are you seeing clients nationwide or just in Florida?
I can see clients nationwide. I focus on helping people to remove toxins in their life and gut health, and just really get on track with a healthy lifestyle. I offer lab work, Dutch testing, GI map, mold test. I offer supplementation protocols that, if their provider gives their blessing, that they can order through me, through my FullScript account. I refer obviously for peptide therapy, also the microneedling. Everything is virtual except obviously the microneedling. I just started taking a sound healing course. I believe that vibrational healing is going to be a huge medicine of the future, and it really fascinates me. And it's actually another nurse here in Florida who I just went to her home for a sound healing and found out that she has a program. It's an online program. So I'm looking forward to seeing what I want to do with that. But I do really appreciate all of your help and being able to create this business, because it's just definitely, it's been life-changing for me.
And it's so amazing because when we are in the sick care system, it's not uncommon if you're like working in the hospital, you have a patient you're taking care of, and then they get readmitted a few months later. And then every time you see them, they're a little bit worse. And then you're like, oh, okay, let me go get you your, chocolate cake and your pizza and your Coke, because, the hospital, it's so insane. Like the hospital is not fostering healthy eating habits. It's just ridiculous, So,
Or in your Jello and your
I know. Oh, yeah. And it's just, yeah. I'm like, okay, are you guys just trying to like guarantee repeat business over here? But when I started seeing clients, and again, with nurse practitioners, they have access to the prescription pad. They can diagnose, they can treat things like that RN levels. there's a lot of people that will like come to me because they're like, yeah, I don't want to go on those meds and I don't want to get that surgery. And they want to work on natural things, which there's so much that an RN can coach them through. And then with the testing, there are tests that typically are not available at a regular PCP's office that nurses do have access to. So I think that's amazing, all of the work that you're doing. And so, you also mentioned that you are virtual, and going to blame my pregnancy brain again because I completely forgot what you said about how you see people. Are you seeing just in Florida? Or are you able to do multi-state as well?
I can do multi-state. Yeah.
Awesome.
I wanted to tell you, I had a client last year and she went through a few months of a program with me. Then she went to a GI doctor, long-term chronic GI issues. And then she went to a functional medicine doctor and she came back and she's like, I can't believe this. I've been to these doctors, all of these people, and the person who has helped me most is you, a nurse. Like I never would have believed it.
Oh, I love it.
Yeah, I really did help her a lot. And it really made me feel so good to be able to have access to all of these tools and modalities and tests and supplements to be able to recommend and show her the data on how they're helping people and what they mean, because that's really what we do, not diagnosing anything. But I did ask her, I gave her a list of labs to ask her primary care physician to order, and the full thyroid panel was on there. And he refused to order it and said, well, if she wants to order labs, she should go get a higher degree. Actually said that.
Uh-huh.
And guess which labs were abnormal? The ones he refused to order.
They were abnormal.
He refused to order them.
Uh-huh.
Somebody else ordered them, another doctor that she went to, and those thyroid, the few thyroid tests other than the TSH that he refused to order were abnormal. And so now she's on thyroid supplementation, and that would not have happened if she just, listened to him. And that makes me sad that there's so many providers out there like that.
So those providers are part of the problem. And those are the run-of-the-mill docs that I complain about incessantly. And, as nurses, when we're in the hospital, we know those providers that, just to be honest, they kind of suck and they don't care about their patients and they're not nice. And then there are the providers that want to have a partnership and they love their patients and they're wonderful to work with. And I think that so many patients, and again, if you're a patient, who your medical provider is, that is your choice. They technically work for you. You can fire that provider. I've had to fire a lot of them. And it doesn't need to be this whole dramatic, you're fired and you leave. You just don't come back. You don't go back to see them. But I have seen some things. I've had clients that have come to me and I review their medical records and I see them and I'm saddened by the negligence that has gone on in their care. But I also understand the system is very broken. It's difficult for those that work in the system. But again, there are some things that happen that are just super unethical. But that's amazing that you're already getting such good feedback. And I went to your website today and it looks lovely. And you've got people have written you really wonderful testimonials. So now your website, I'm going to post it in the show notes for if there's anyone that wants to work with you. Now, I'm sorry, is it LizSandtWellness.com or is it Elevate Wellness?
LizSandtWellness.com.
Okay, Liz Sandt. Okay, so it's Liz Sandt Wellness is your website, but then Elevate Wellness is your practice. Is that right? Okay, cool. I wish I could have my last name and my website, but it's Schreibfetter. I can't do that. Liz Sandt has a good ring to it, but it was so great to be here with you today. And yes, be sure that you check out our links in the show notes if you want to learn more about Liz and what she is doing.
Thank you for tuning in to the Functional Nurse Academy graduate feature. If this conversation inspired you, don't forget to subscribe. Leave a review and share it with a fellow nurse who may be ready to level up in their career. If you want to be our next success story, feel free to visit functionalnurseacademy.com. If you are not a nurse, if you're in another healthcare specialty, I can train you as well. So go to christianfma.com for that training program. And until next time, be safe, be well, and God bless.
This was brought to you by Functional Nurse Academy. For more information, please visit functionalnurseacademy.com.